As the fellowship director, I'm not only responsible for the administration of the program and the quality of our didactics and the program overall, but I work very closely with the fellow in the operating room. I tend to do both complicated cases and more routine pediatric urology cases with the fellow, and I really enjoy that interaction with them clinically, but also the opportunity that I have to get to know them personally. Hi, my name is Elizabeth Yerkes. I'm the Fellowship Program Director for Pediatric Urology here at Ann and Robert H. Lurie Children's Hospital, Chicago, and McGaw Medical Center at Northwestern University. Our fellowship is 2 years. The first is the non-clinical year, and during that year, the fellow will be mentored very heavily by our division, and there's lots of resources to help them accomplish what they'd like to accomplish. That year should really be driven by their interests, but is very much supported by the resources of the department and the expertise of our staff. During that year, the fellow can choose between a purely clinical research program, or they can choose a basic science track for the year. They also could choose a clinical research approach, but also earn the certificate toward a master's in clinical science and investigation, and that's supported by the department. And during the second year, it's entirely clinical, and so that will be a very busy experience in the operating room, as well as running the inpatient team that consists of residents from most of the programs within the city. So the fellow is the lead of that team. The approach is a graduated independence and responsibility for the cases in the operating room under very heavy mentorship of our division. One of the philosophies of the division is that this is a dress rehearsal for practice in academic pediatric urology, and so that involves a very strong clinical experience, both the medical clinical as well as the surgical aspect of things, and gaining comfort with practicing in whatever practice situation they choose, whether it will be an academic pediatric practice or private practice. We're looking for a fellow who is motivated, and a fellow who gets along well with other people, and a fellow who has aspirations to deliver great care and innovative care, and wants to take really good care of patients and families over their career. They need to have excellent communication skills because they'll be leading a team of residents from diverse institutions and diverse backgrounds, and we have a large faculty that the fellow is going to interact with as well, so communication skills are extremely important. There are a lot of really excellent programs in pediatric urology in the country, and consider ourselves among those excellent programs. That's based on our clinical expertise and the research productivity and thoughtfulness that our division has represented, and we're recognized nationally for those. I think another thing that's pretty special about our department is we're recognized for sometimes being a little bit different and really enjoying each other for that. And people often remark that we are always together at meetings and really enjoy each other socially. And it's that family concept within our division that I think makes us special. So it's not just the clinical recognition or academic recognition that our department has received. I think it's the whole package of who we are as a group and what we mean to each other and what we impart to our fellows and what they'll give in the future.